Okay, we're gonna put in the rings. And we're gonna put in the ear wire. Now for the second one. And this is the final completion of the plastic earrings. This is what it looks like. This is a finger tie-dye sort of painting. We're going to complement our earrings by adding a bangle. This bangle was made from just the ordinary piece of plastic tube with the same tie-dye finger painting effect. This is what it looks like. You're just gonna set a little piece of wooden stick. We're just gonna insert it into the end piece, and we're just gonna add the other end. We're going to enhance our bangle by just adding some gold rings. We're gonna start by just putting the gold rings in the joint area. Isn't this unique? Just look at this. This is the finished look of the earrings and the bangle. I hope you've enjoyed this tutorial. The month of July is plastic free, so I am encouraging you to reduce the use of single-use plastic.
We are doing our part to help making sure that the coronavirus doesn't spread anymore in St. Kitts and Nevis.
Our role here is just to ensure that the public being safe, and at the same time we're keeping ourselves safe. We're ensuring that each other keep at least 6 feet distance apart.
I like the fact that they put this into place, because most of the time the people are not honest. They tend to come and cheat, and many people who are here from since 6, 7 o'clock in the morning standing up waiting long, other people come in and excusing themselves within the line.
Some of them are 6 feet apart and the others are jumbled up too much on one another. Each supermarket where I attend, and even in the pharmacy, they're cooperating very well, and it's a good thing that they're doing. Very good.
I am very passionate about being here, performing my duties on the front line of COVID-19. Our job is not so easy, but we all know that someone has to do it.
It's not an easy job, it's not easy, very difficult, but however, country above self, and we managed to take on the task.
Prime Minister, you shall step up the police them money, because they out here in the hot sun to keeping the people them from fighting and shoving in the line. And what they do is a very, very good job.
We're just trying to do our part to make sure that St. Kitts can actually recover from this.
Yeah, people of St. Kitts and Nevis need to take this COVID-19 thing serious. The more cases we get, the more the place gonna lock down. Y'all making noise, but y'all still ain't doing what y'all supposed to do. Stop all
for making life and death decisions. NEMA will collaborate with the Met Office to bring you the local forecast, which will have the type of information you will need to make critical decisions. Listen to the local forecast. A message from NEMA.
You better prepare. Disaster can happen anytime, anywhere.
Before touching the mask, clean hands with an alcohol-based hand rub or soap and water. Take the mask and inspect it for tears or holes. Orient which side is the top side, where the metal strip is. Ensure the proper side of the mask faces outwards, the colored side. Place the mask to your face. Pinch the metal strip or stiff edge of the mask so it molds to the shape of your nose. Pull down the mask's bottom so it covers your mouth and your chin. After use, take off the mask. Remove the elastic loops from behind the ears while keeping the mask away from your face and clothes to avoid touching potentially contaminated surfaces of the mask.
And welcome to our National Emergency Operations Center COVID-19 weekly briefing today, the 2nd of September 2020. We do apologize for the late start, and we thank you very much for your patience. We continue to provide you information with respect to the COVID-19 global pandemic. As the pandemic, of course, is still with us, while many countries are searching for a vaccine, we have to continue to put all the measures and protocols in place to mitigate against the transmission of the COVID-19 pandemic. Hence, that is why we keep having these weekly briefings to keep you informed and where you can ask questions with respect to what is happening. So thank you very much for joining us, for partnering with us with these weekly briefings. At one time they used to be daily, not too long ago, but now they are weekly. I would like to invite first Superintendent Cromwell Henry, Divisional Commander for District A, to give us his report. Superintendent.
Thank you, Mr. Williams, and a pleasant good afternoon to all listening to this broadcast by whatever means. New regulations have been published, and these will expire on September 26. These regulations further prepares us for the first phase reopening of the borders. The nightly curfew has been removed. However, all the COVID-19 protocols remain in place. The wearing of masks continues to be one of the more effective means to combat the spread of the virus. However, some modifications to this requirement has been made in these new regulations. Minor modifications, I will add. Regulation 8.2 speaks to a person shall not be required to wear a mask, A, if he is under the age of 6 years old. Previously, it was 3 years. That has now moved to 6 years. If he's between the ages of 6 and 11 years old, and there is lack of adult supervision for providing for the putting on or taking off of the mask. So persons who are between the ages of 6 and 11 years old, if there's a lack of supervision for the putting and taking off of the mask, then there's no requirement to wear a mask. If he or she suffers with a disability, cognitive impairment, dementia, asthma, chronic obstructive lung disease, or other similar health condition, or if he's within a private space, and this includes a private vehicle. So these are the conditions under which a person would not be required to wear a mask. If you are under the age of 6 years, if you are between the age of 6 and 11 and do not have adult supervision, if you have some health condition that makes it difficult for you to wear a mask, or if you're in a private space, which includes your private vehicle. The new regulation also eases restrictions on the opening of schools. All public educational places of institution may reopen, and we have heard the announcement of the opening of school on September 7th. However, all private educational places of instruction shall apply to the Ministry of Education for approval of reopening in the form set out in the second schedule. In addition to the form of application In the second schedule of the emergency regulations, the protocols to be observed for these private schools are also detailed in that particular schedule. And that schedule speaks to physical distancing with respect to inside and outside classrooms, distance markers for the dropping off or picking up of children, and the signing in and out of a register, among other requirements. It also speaks to the wearing of masks by parents and staff while on the compound, and the arrival and departure screening protocols. The schedule further speaks to hygiene and sanitization protocols, food preparation protocol, as well as health and safety protocols. In the interest of time, I will not go through in full details with all the details of all these protocols, but I would encourage you to have a read of the second schedule of the COVID-19 Emergency Powers Regulation. This is available on the COVID-19 website or the SKNIS website. I would encourage persons to go there and look for it. Clubs or management teams, another restriction that has been eased in these regulations is the restriction on the attending sporting events. The restrictions on attending sporting events. A person may attend sports training or other practice sessions for amateur or recreational sporting events. However, the basic COVID-19 protocols still apply. Wearing of face masks, social and physical distancing, hand hygiene, and other sanitization behavior are still basic requirements at sporting events. Clubs or management teams must apply to the Ministry of Sports for permission to host these events, and it is important to note that only 50% of the capacity of the stadium will be permitted, and physical distance of 6 feet must be observed between persons in the stands or the stadium. Notwithstanding the lifting of the curfew, public entertainment and other social activities still require permission from the Commissioner of Police prior to hosting these events, and the end time for the events would still be one of the conditions. So a lack of curfew doesn't mean that there is no end time to public entertainment. That would be a condition, and that will be listed that will be given in your permission letter. We continue to urge residents not to become complacent and ignore the recommended protocols. As the borders are open, our risk will increase and the likelihood of the reintroduction of the virus in the country becomes greater. If we are wearing our masks, social and physical distancing, and practicing good sanitization behavior, our chances of becoming reinfected or infected will be significantly reduced. So I urge us all to cooperate with the authorities and protect your own health by following all the protocols that are recommended. Thank you.
Thank you very much, Superintendent Henry. I now invite Dr. Hazel Laws, our Chief Medical Officer, to give us the Health Emergency Operations Center COVID-19 situation report.
Thank you, Mr. Williams, and a pleasant good afternoon to everyone. As per usual, it's my task to share with you the Health Emergency Operating Center's situation report for today, September the 2nd, 2020. The Ministry of Health continues to test all suspected cases of COVID-19. We continue active surveillance, and we continue to promote the non-pharmaceutical measures to prevent and contain COVID-19. Now globally or internationally, the World Health Organization informs us that 25.6 million persons have been confirmed with COVID-19 to date. The death toll stands at 852,758. 5.9 million of these persons reside or live in the United States of America. And in the USA, the death toll stands at 182,585. In the Caribbean region, we have over 169,000 confirmed cases of COVID-19, and in terms of recoveries, we have 94,843 persons recovered, and to date, 2,816 persons have died from this dreaded disease. In St. Kitts and Nevis, we have 0 active cases. We've had 17 confirmed. They have all recovered. I repeat, we have 0 active cases. At present, we would have tested 1,635 persons to date. Now, I want to just pause and underscore that the RT-PCR molecular test, which is the gold standard, remains the accepted or acceptable COVID test within the Federation. I also want to bring to your attention Section 19 of the Emergency Powers Regulations, and it states, requirements on private medical laboratories. Notwithstanding the fact that the Caribbean Public Health Agency has not yet approved any private medical laboratory to do testing for the 2019 novel coronavirus or COVID-19, where a private medical lab does such testing on a person and the result of such testing is a positive result, the private medical lab and the person so tested shall immediately report and forward the results to the Office of the Chief Medical Officer within the Ministry of Health. Subsection 2 reads, where a private medical lab or a person fails to report and forward results to the Chief Medical Officer in accordance with Subregulation 1, the owner or operator of the private medical lab or the person, as the case may be, commits an offense and is liable on summary conviction to a fine under Regulation 21. So that just underscores that the RT-PCR molecular test remains the gold standard and the acceptable COVID-19 test locally. To date, or at present, we have 43 persons in quarantine, and 26 of these are in St. Kitts and 17 in Nevis. To date, 237 persons or nationals would have returned to the Federation. Okay, so this is current information. At present, the second batch of 7th semester students from the Ross University School of Veterinary Medicine, they just landed at our RLB International Airport. 14 of these students would have come from Puerto Rico on 2 charters, and 132 students and faculty would have come into country from Miami. 6 faculty members would have arrived from Antigua via charter. So at present, or today, let me just back up here. On Saturday, we are expecting 6 other faculty members. And so between today, Wednesday, and Saturday, September the 5th, 158 students and faculty members would have come into country for the Ross University School of Veterinary Medicine. I want to assure you that these individuals would be tested upon arrival. They would go into compulsory quarantine for a period of 14 days. They will be retested at the end of the 14-day quarantine period, and once their RT-PCR molecular tests are negative, they would then be officially released and be allowed to integrate into our society. Okay, so this afternoon I wanted to just provide you some additional information regarding asthma in the context of COVID-19. I'll begin by speaking specifically to persons who are asthmatics, who have been diagnosed with this respiratory condition. And the recommendation is that we want you to be compliant with your regular asthma medication in order for you to prevent any flare-up or exacerbation of your condition during this COVID-19 pandemic period. So we want you to remain on the same asthma maintenance medication for as much as possible. We want you to take your medication every day so that you are as stable as you can be. We want you to avoid any known asthma triggers. So for example, avoid smoke, avoid dust, avoid sprays, anything that triggers your asthma. We want you to do all you can to avoid such triggers. And if you are asthmatic, it's very important that you wear your face mask when in public spaces. Remember to remain at least 3 feet away from others when in a public space, and your hand hygiene is very important. Now, what does the literature tell us about asthma and COVID-19? Now, the Centers for Disease Control and Prevention, the CDC in the United States, currently lists asthma as a risk factor for severe COVID-19 disease. And this is based on the science or the literature, which tells us that persons with asthma have an increased susceptibility to respiratory infections caused by viruses such as COVID-19. Now, in a recent study conducted by researchers at Harvard, they analyzed 2 main asthma subtypes, that is allergic asthma and non-allergic asthma, meaning allergic asthma refers to asthmatics who experience flare-ups when they are exposed to allergens like pollen, mold, smoke, dust, sprays, etc. So that's the allergic type or phenotype. The non-allergic phenotype of asthma is really, those asthmatics who experience worsening of their condition when they exercise or undergo stress, like lack of sleep, lack of adequate hydration, lack of food, cold weather, and other similar factors. So what the study found is that the non-allergic phenotype is associated with a likelihood of more severe asthma. So in other words, those asthmatics with the non-allergic phenotype, they are at risk of developing the more severe form of COVID-19 if they were to become infected. All right, so this just highlights the allergic type of asthma and the non-allergic type. So these findings were driven by a significant association of the non-allergic asthma with severe COVID-19. However, generally speaking, persons with asthma, you tend to have a higher risk of the severe form. So in essence, if you are diagnosed with asthma, if you're an asthmatic, you need to do all you can to reduce your risk of exposure to the virus. We are preparing for the reopening of schools next week, and I am aware that there are some parents who have children with asthma. They are particularly concerned in terms of the safety of sending their children to school. All right, and so what we want to tell them is that we want to reassure families that severe COVID-19 infection is generally rare in children and young people. And so if you have a child who is asthmatic, your role is to ensure that that child is compliant with his or her regular medication so that their condition is stabilized. So that would be the most important thing as you prepare for the reopening of schools. And no, asthma can be confused with COVID-19 respiratory symptoms. And so when school reopens, children will be screened at the entrance, their temperature will be taken, and then they will be asked and observed for some of the signs and symptoms of COVID-19. And the signs and symptoms of COVID-19 are quite similar to the signs and symptoms of asthma. And so it's even more important, if your child is asthmatic, to make sure that they are compliant with their medication, stable, and not coughing, so that they won't be turned back or turned away from school. So the last bullet, the second to last bullet point says, children and young persons with asthma might be at high risk of missing out on school when school reopens. That is, if they are experiencing any of the signs and symptoms of asthma that are similar to COVID-19. And we want to ask the teachers and those in the school setting to be mindful and considerate of the concerns of children with asthma and their parents. I want to just share a little bit about face masks. I want to highlight one fact, that wearing a face mask, it has been proven to reduce the chance of spreading and contracting COVID-19 by about 70%. So this just highlights the importance of the face mask. It protects you, really. Where should you wear a face mask? Indoor spaces that are open to the public, outdoor public spaces where a number of persons are gathered, on public transport. So if you're going on the bus, if you're going on the ferry or the sea taxi, it's important for you to have on your face mask. In offices, at work, shops, supermarkets, bakeries, wherever, those public spaces where you're going to interact with individuals. And I must add, if you're going into a restaurant, you would only take it off when you're drinking and eating. If you're going to the bar, you know, interacting with a number of persons, especially if the space is closed and crowded, wearing the mask is important, but of course, you're going to have to take it off when you're drinking and sipping your drink. If you're going on the strip, these are the places where you really need to wear your face mask. And I'm stressing this point because we are preparing to reopen our borders. And once our borders are reopened, there is a high risk of reintroduction of the virus into our federation. And so we won't know where the virus is. And so you need to really be serious about wearing your face mask to protect yourself and reduce the risk of exposure to the virus. How long should one keep on a face mask? I got that question from the media yesterday. So if you are at a restaurant, or if you are on the strip, or you are going to a function, you need to keep on your face mask whenever you're in a public space around a number of persons. You really need to keep on your face mask for as long as it's tolerated, for as long as it's possible, and for the duration of the time you are in that risky environment. And so you will be able to tolerate your face mask for the required amount of time if the face mask fits appropriately. And so it's very important for you to wear a mask that fits properly. Because once it's comfortable, you can tolerate it for the duration of time that it's required to protect you and reduce your risk of being introduced to the virus. What types of face masks should one wear? Okay, so here we have a picture of the surgical face mask and the fabric face masks that are produced locally. Now, the fabric face mask provides good protection from the virus. All right, it filters out a lot of stuff. All right. However, the surgical face mask provides you even more significant protection. And so if you're going to the supermarket and to pay your bills, walking around town, going on the strip, your fabric face mask will suffice. However, the surgical face mask, I will recommend the surgical face masks for those older persons who have chronic illnesses like diabetes and hypertension, cancer survivors, etc. Because the surgical face mask provides you more significant protection. Thank you.
Thank you, Dr. Laws. You mentioned the people at the bars who, you know, they go drinking and so on. When they're finished, they might not remember where to put the face mask. We now invite Mr. Abdia Samuel, Chair of the COVID-19 National Task Force and National Disaster Coordinator, to address us.
Thank you, Mr. Williams, and good afternoon all, watching, listening via whatever means. This afternoon, we continue to update you regarding the fight against the COVID-19 pandemic. I want to also welcome the over 158 students and faculty that will be arriving here that have arrived to St. Kitts and Nevis for the Ross University students, our second semester, the second batch for the 7th semester students. I think the exercise has gone very well, and I want to thank the Royal St. Christopher Nevis Police Force, the St. Kitts Nevis Defense Force, along with the members of the task force, and also for the members of the NEOC, in collaboration with the Ross University faculty, who have been working assiduously on the ground to ensure that all the protocols and procedures are followed to ensure a smooth process. So kudos to everyone who have been working hard to ensure this goes smoothly. The COVID-19 task force has been hosting a number of meetings with stakeholders. We met with the taxi operators, the Ministry of Tourism, in particular the St. Kitts Tourism Authority, and we also received updates from the St. Christopher Air and Seaport Authority. In our discussion with the taxi operators, retrofitting their vehicles to help us in the fight against COVID-19, and also to assist them in generating economic activities, as many of the taxi operators have been dormant due to the impact of COVID-19. So in our discussions, the taxi operators have showed us or become innovative in explaining another means of using a barrier that is not plexiglass to support the fight against COVID. So they are recommending for the task force to review, in collaboration with the medical team, to review the use of polythene plastic sheeting with Velcro tape to ensure that that barrier is created between the driver and the potential passenger, and that is incoming passengers, of course. In our demonstration, we felt very pleased with the demonstration that was shown by the taxi operators, and I want to thank the King Socrates, and also the president of the Taxi Association, Barry Daniel, for ensuring that this demonstration was done, and we could look at the various type of vehicles and how the plastic can actually suit the various shapes and forms of vehicles, and it can be cut to suit. And it was very encouraging, and I think we have a good plan going forward. However, in retrofitting, we also encourage the taxi operators to look at wearing the face mask to help ensure that that barrier is continued to be kept between them and the incoming passengers. Also, we are asking to equip the taxis with hand sanitizers, and also in some of them, as you see here, they're being displayed before you, have already gone ahead and implemented the plexiglass. One of the questions we were asked is the collection of money. And what we have said to some, to become innovative and creative, and look at the EPOS terminal to allow for e-payment. If some of you have traveled to other countries such as the United States, you will see that some cabs have the ability for you to swipe a card and be able to pay for your trips. These are some of the things that we have to put in place if we want to remain resilient against this COVID-19 pandemic. The COVID-19, as I said, met with the Tourism Authority, and the tourism, I want to laud the work that is being done by the Ministry of Tourism in training stakeholders within the tourism sector. They have trained so far on St. Kitts 933 persons, and the Nevis Tourism Authority, we're informed, has trained 1,500 persons thereabout. And these persons are in the areas of hotel and condos and villas, taxi operators, water sports and catamaran operators, vendors, retail operators, restaurant and bar operators, persons operating spas, and those individuals working within the casino, bars, and entertainment. And that is very critical and important for us as we endeavor to open our borders. We also met with Casper, who was able to demonstrate the infrastructure design in preparing the airport to facilitate incoming commercial flights. We were very pleased with the presentation. It was practical and something that is adaptable, and it's much easier to implement. I think in principle, everyone had an agreement that this will work best for us for now in St. Kitts and Nevis. The National COVID-19 Task Force submitted to the Cabinet, Federal Cabinet, the pre-approved quarantine site policy. And this is a policy whereby persons who owns condos, villas, etc., can be able to quarantine in the place of abode for them. How do you access this? You submit the request to the COVID-19 Task Force for the inspection of the property, and you'll see the email covid19taskforce@gov.kn, and you will make your official request via there. So what is the purpose of this document? The purpose of this document is to pre-certified homes quarantine, to allow persons the opportunity to stay in their place of abode without increasing the risk of transmission of COVID-19 to others, as well as to specify the conditions of quarantine in such locations. And that's critical. We are going to need much quarantine space going forward once we are open to commercial flights entering, and our borders also opening to other means of entering St. Kitts and Nevis, such as yachts and other types of large vessels. So therefore, the cabinet has agreed in principle that this is one of the ways in which we can increase our quarantine capacities. Now, there are critical things we want to make sure. So I'm going to just highlight some critical things. We want to make sure that once you are approved, you should ensure that adherence to the COVID-19 protocols are carried out and carried out well. We don't want a situation that you feel like you go into this space and then you get tired and you can go. That will not happen, because one of the other agreements for you to be able to be approved is to ensure that you have approved security, and that will be private security, and this security will be prescribed by the Office of the Commissioner of Police. The security will be monitoring you 24/7 during the quarantine period, and it's critical. Once you sign on the dotted lines, you have to adhere to these agreements. So I must inform you that the pre-approved quarantine site policy has been approved, and you can access this by emailing your request to the COVID-19 task force at gov.kn. When we look at the hurricane preparedness updates, at present, there are no imminent threat of cyclonic hazards to the Federation of St. Kitts and Nevis. However, there are two systems that are existing in the Atlantic Basin, so I am appealing to all to remain vigilant and monitor these systems as they continue to develop in the Atlantic Basin. Again, if you do not have a plan, develop one now. Use this opportunity to develop one. And if you have one, review it. Hurricane Laura, which increased to a Category 4, passed us as a tropical storm. And that is enough to remind us that we have to prepare and we have to be ready, and the weather is something that is very dynamic. So continue to prepare for any potential impact of any cyclonic activity. Thank you, and that is my report for today.
Thank you very much, Mr. Samuel, for your report for today. That brings us to the question and answer segment of our briefing, and I have quite a number of questions today. The first question: what is convalescent plasma and how does it work? I learned it was just approved by the FDA for treating of COVID-19. Dr. Wilkinson.
Thank you, Leslie. So the question was, what is convalescent plasma? And the person said that they learned it was just approved by the FDA. Now, when someone convalesces, it means that they get better. And therefore, convalescent plasma is plasma that has been obtained from persons who recovered from COVID-19, as we are speaking about COVID-19. What is plasma? If you were to donate blood and the doctor separates the red blood cells, the liquid part that is left, that is the plasma. Now, when someone recovers from COVID-19, they would have developed antibodies to fight this disease. And therefore, it is thought that convalescent plasma is rich in antibodies that are effective in fighting COVID-19. So there are a number of studies that are undergoing where they've been using this plasma and injecting it into patients who are severely ill with COVID-19. The presumption is that these antibodies will help to fight the virus until the person mounts their own immune response. That is, they develop their own antibodies to fight this disease. Now, yes, the FDA gave emergency use authorization of this drug, and there was a big song and dance with the President of the United States the other day touting this as a major breakthrough. But we have to understand that an emergency use authorization simply means that the FDA is saying it is largely safe and maybe of some benefit. However, just today, the National Institute of Health came out saying that they cannot either support or refute the use of convalescent plasma in the treatment of persons with COVID-19, since we don't have sufficient information or data to support this. And so, by and large, I don't think it's therapy that's going to be used widely. First of all, you would have to get plasma from persons who recover, and it requires persons coming forward and donating the plasma. So it's not going to be available worldwide the way you would manufacture a drug. And so I suggest that we just hold, strain, and wait to see what happens with the convalescent plasma.
Thank you, Dr. Wilkinson. The second question, what's the status with the plans for putting people in pre-approved home quarantine sites? Who will take that one? Mr. Samuel.
Yes. Mr. Williams, thank you for the question. As I just mentioned, the policy has been approved. All you have to do now is apply to the task force via the COVID-19 email address, and that is covid19taskforce@gov.kn. After that, an inspection will be done on the property. After the inspection is done, you will then have to reach out to the Office of the Commissioner of Police for the security that will be prescribed to you, which you have to contract, and that will be at your cost. After that is done, then you will be given the necessary permissions to utilize the particular facility for quarantine for the period. Now, it's critically important for you to note that you still have to, A, pay for your testing. 2, the medical personnel will visit you, the same as we are doing with the government-designated quarantine facilities. And at the end of the 14th day, you will still be tested before you can be allowed to integrate into society. So that's approved, so persons can now apply for this particular process. Thank you.
Mr. Samuel, thank you. Third question, why are the ships that were scheduled to be here on the 19th and 24th of August not here? I heard Dr. Wilkinson say in a press conference that this would have been one of the safest repatriation exercises. Dr. Wilkinson.
We have also said that the safety and security of our nation is our first priority. And when I said that, we had gotten the information and assessed the risk associated with having the ships come here. And at that point in time, we thought that it was low risk. However, prior to the 19th, we received some further information that made us reassess the risk. And we put other things in place, which put a delay on the arrival of the ships. So you may see them coming at a later date, but you must remember that the safety and security of all is of paramount importance.
Thank you, Dr. Wilkinson. I know that people actually were over at Port Zante waiting to see cruise ships. They haven't seen them in a long time. The fourth question, being locked up for 14 days, what we call a quarantine, is very stressful. When are we going to see a shortening of this quarantine period? Dr. Laws.
And yes, Mr. Williams, I agree with the person who posed the question. that if you are restricted for 14 days in a fixed space, it's very difficult psychologically. However, the COVID-19, the SARS-CoV-2 virus that causes COVID-19 is a very complex virus because let's just reflect on one of our cases whereby an individual was tested upon arrival negative. After 14 days in quarantine, sampled, tested negative. On day 15, resampled, positive. And so I share that to underscore that the 14-day period of quarantine and testing is the ideal approach in order to reduce the risk of reintroduction of the virus to the Federation. So that's the ideal. And so at present, the medical team is reviewing the science and the literature because the information is changing, is very dynamic. So we are presently looking at the science and the literature to see if this can be changed, and if we were to shorten the period of quarantine, how many days would be ideal. Again, we continue to be guided by the science, and that's what we are combing. We are combing the science to determine if we can shorten the period of quarantine, and if so, by how many days. And so, as we draft and develop the protocols for reopening our borders, this will be determined. Thank you.
I just also want to add that quarantining doesn't necessarily have to mean social isolation. And that's one of the reasons why in the government-approved sites, we have access to television and internet, etc., so that you can communicate with persons. Because ever so often, myself, Dr. Laws, we get calls from persons crying, want to come out from quarantine, but the family has to help also. And so if you know that you have somebody who is in quarantine and they have access to the internet, telephone, etc., you need to do things so that you can help to reduce that social isolation. Because at the end of the day, you're sacrificing 14 days but avoiding you, if you are inadvertently infected, taking it home to your loved ones and taking their life.
It would be nice to have a swimming pool too. Question number 5. What is the difference between the rapid antigen test and rapid antibody test? Dr. Wilkinson.
Yes, we've been hearing a lot about rapid tests recently, and we have had several discussions here about the rapid antibody test early on in our discussions here. And I'll talk about that first. So the antibody test, when somebody becomes infected, they produce antibodies, and the antibody test detect these antibodies. Now, the problem with the antibody test is the antibodies are produced sometime after the person has gotten infected, and recent data has shown that the peak increase in the IgM, which is the first one that occurs, can occur up to 2 weeks, which means that the person could be spreading the virus while they're infected and test negative, although they are infected. We also know too that there's cross-reactivity with other coronaviruses that the person would have been exposed to. And so I mentioned that to the skeleton that we have had a policy here not to use the rapid antibody test. The test that Dr. Laws keeps speaking about is the PCR test that tests for the gene of the virus. And that is the gold standard. However, there are new tests that have been developed to test for the antigens on the virus. If you look at the pictures behind there, those are the antigen on the surface. And these new tests, they are rapid tests where they can be done on site and you can get the results back in a few minutes. And that is the rapid antigen test, and that is thought to be the way forward in terms of if we are going to open our country and these tests are available, because they are available in a short time, they're cheap and easily available. And so hopefully we will have access to these rapid antigen tests so that we can test persons very quickly and determine whether or not they can be released from quarantine or are free to circulate in our community. Thank you.
Thank you, Dr. Wilkinson. The sixth question. We recently received donations of ventilators from the USA and Taiwan. What are our plans for all these ventilators if we have no cases? Dr. Laws.
And so the Ministry of Health is extremely happy that we've received these costly donations. At present, we have 0 active cases, 0 cases of COVID-19. At present, we have 0 cases COVID-19. However, we are also preparing to reopen our borders. With that comes an increased risk of reintroduction of the virus into the Federation. And so more than likely, we will be seeing our second wave of infections. And probably, we are not sure, our second wave may involve many more cases than the first, and who knows, they may be moderately to severe or even critically ill. And so what I'm trying to say is that we are happy for the ventilators because it prepares us for possible outbreak, a second wave, and cases of COVID-19 who may be moderately ill, severely ill, or even critically ill. So in other words, we are happy because then we are even better prepared for a second wave of COVID-19 cases. Thank you.
Thank you, Dr. Laws. The seventh question, with our borders due to open in October, how prepared are we for the massive influx of persons? Mr. Samuel.
Thank you, Mr. Williams. An excellent question. I think we have been doing well in preparing for this opening to commercial flights and having more persons entering our borders. We have seen some of the exercises that we have done. For example, the return of the Ross University students in large numbers. That has given us the perspective of how well we can manage these numbers under the context of COVID. We have also looked at some of the best practices that are happening in the Caribbean region. And because we have been able to remain the way we are right now with our borders closed, we have been able to see and analyze so that we can implement some of the best practices measures and continue to use the non-pharmaceutical measures that we continue to promote day in, day out, such as wearing the mask, having the legislation to support what we wish to do to get the best practices from persons, the behavioral change. You can look at the training that is happening because there has to be a behavioral change. If we don't have a behavioral change, then basically we are going to go back to zero. So I believe that we are making significant progress to be ready. And by the time that we are able to open our borders, it doesn't mean that we are not going to get cases, but it means that we are going to be able to reduce the impact of the risk that is involved in opening borders at any time. Case in point, I remember when Jamaica opened its borders, there was this video that was done and everybody sent the video around saying it's the best practices, it's everything else. And no, I'm not seeing anybody sending any videos basically saying how the situation now has deteriorated in Jamaica. Another illustration I want to make is the Turks and Caicos Islands, because we have been studying a number of these countries that have opened already. And in the Turks and Caicos Islands, they were only accepting that once you come with a negative test, then you are free to move about. However, today, the Turks and Caicos Islands have actually increased their curfews. They had to immediately go into a curfew of from 8 to 5 a.m., and now they have moved to a curfew from 5 p.m. to 5 a.m. due to the exponential growth of cases in the TCI. So this has given us an opportunity to look at all these measures, have consultation with a number of stakeholders, and I am certain that we are going to be able to come up with the best practices for us in St. Kitts and Nevis to be able to manage the situations once we open our borders. I think that's the best what I can say. I don't know if Dr. Laws or Dr. Wilkinson want to add anything else.
I just wanted to add that the various, the relevant ministries and departments and authorities are working together to prepare the Federation for the reopening of the borders. So, for example, the Ministry of Health is collaborating with SCASPA, the Ministry of Tourism, the Tourism Authority, the hotel industry, the taxi operators. We are all collaborating in terms of preparing for the reopening of our borders. Just to highlight, for example, there are going to be infrastructural changes taking place at the RLB Bradshaw Airport in preparation for reopening of our borders. And so the arrivals hall will be transformed from how you know it. And so we are going to also establish or develop a health section or a significant health station in the arrival section of the airport. So inbound passengers will have to go through the health section, health screening, testing, getting your temperature done before you are cleared to proceed to immigration. So there will be changes in immigration, and then you proceed downstairs to customs. So there will be obvious changes in the customs area. And then when you would have left the airport, the inbound passenger will have to travel on pre-certified taxis or ground transportation to pre-approved or COVID-certified hotels, etc. And so just to highlight that all the relevant agencies are collaborating in, in terms of preparing ourselves for the reopening of our borders. Thank you.
And I just want to add something that is more general, because as countries open, the WHO recommend that we do a number of things to protect ourselves. Number one, we have to try and reduce what's called amplifying events, like overcrowding in stadiums, churches, etc. And parties. These are things that we need to continue to control. We need to protect the vulnerable, those who are more likely to die from the disease, the elderly, those with pre-existing conditions. You heard the CMO spoke about asthma, etc., and healthcare workers. So we need to make sure that those persons who are going to be doing the testing, that they're properly prepared. They also emphasize the importance of personal responsibility, because as we open, people seem to think that, well, the government has to do everything, but we need to take our personal responsibility in doing all the little things that we keep emphasizing that you need to do to prevent the virus from spreading. And lastly, we as a country need to continue with our testing, isolation, quarantine, and so that's still going to be a major part of what we have to do to control the virus once we open the borders.
I just wanted to add that as we prepare to open our borders, I think every citizen, everybody in St. Kitts and Nevis has a part to play as we prepare to open our borders. So it's not just the relevant ministries and departments. Every single person has a responsibility to protect his and herself from exposure to the virus, which will come back in once the borders are open. And so it's then, well, even now, you need to wear your mask. So in other words, when you drive on the strip, etc., you should see everybody wearing a face mask. So the wearing of the face mask would become even more important when our borders open. And now that lies in the hands, that decision or that action lies in everybody's hand. That's everybody's individual and collective responsibility as we prepare to reopen. And then physical distancing, remaining 3 to 6 feet away, north, south, east, west from individuals, social distancing, avoiding mass crowds, and hand hygiene, cough etiquette becomes of paramount importance when our borders open. And so the preparation for opening our borders lies in it's all our responsibility. Thank you.
Thank you to all three of you. It was quite alarming to read today that Jamaica had reported 224 new cases of the coronavirus in one day, which is a record high for them, and also 3 deaths. Amazing. Okay. The 8th question. What's the recommendation as it relates to masks with valves versus those without? Dr. Wilkinson.
Okay, masks with valves were actually industrial masks. In other words, if, for example, you were refurbishing your kitchen and you bought an industrial mask, it has a valve so that when you breathe in, the air is filtered, but you can breathe the hot air out through the valve. Now, we have recently seen masks being sold with valves to protect against COVID-19, but that is thought not to be good, and the CDC doesn't recommend the use of masks with valves because you do not protect the person who you are in front of, because when you breathe out, the air can go to the valve and you can have the droplet spreading, and so we don't recommend the use of masks with valves if you're around persons.
Thank you, Dr. Wilkinson. This is our final question for today. And the question is for either one of the doctors, medical doctors in the room. There has been a video being circulating on social media of someone said to be a medical practitioner. He claims that the temperature gun is detrimental to one's health, as it will impact the pineal gland in the human brain. He said that taking the temperature would be safer if it is done by using one's wrists. Is there any scientific basis for this belief? Pineal gland damage. What is your medical opinion on this matter? Dr. Wilkinson.
The pineal gland is a very small gland located deep inside the brain, and it is far removed from any external structure that can cause damage, and specifically the infrared thermometer that is simply picking up the temperature from the forehead. There is no way it can damage the pineal gland. And so what I can say right now categorically, I don't have any medical information to suggest that the temperature gun can cause any damage to the pineal gland, and so we'll continue to use them. If by chance tomorrow I learn something new, I will come back and share it with you. But I can say for now that that is what's called misinformation.
That brings us to the end of this press briefing, and that is why we are here, of course, to clear up misinformation. We want to thank Mr. Samuel. We thank Dr. Laws and Dr. Wilkinson. We also thank Mrs. Christmas Jacobs and the media, ZIZ, and all the other media in the Federation, and Superintendent Henry. We also thank Ms. Vesta Southwell as well, and all who continue to partner with us here at the NEOC. And of course, the biggest thanks go to you, the audience, who continue to pay attention to what is happening in St. Kitts and Nevis with respect to the COVID-19 pandemic, how it can impact you, and what you must do to follow the protocols and measures for your own health, for your own security and safety. Next week we will be back with another NEOC COVID-19 weekly briefing on the 9th of September. Thank you very much. Take care.